scope of practice. So what does a naturopathic doctor actually do? So what naturopathic doctors do varies a lot from doctor to doctor and also from state to state. In states where naturopathic doctors are licensed as physicians, and in states where the practice law allows for what's called full scope of practice, naturopathic doctors can function as primary care doctors offering yearly checkups, lab work, diagnostic imaging, physical exams, prescription medications, and even doing minor office procedures like injections or biopsies or mole removal or suturing people. Indies and full scope states also do spinal adjustments. They may offer IV therapies or orthopedic injection therapies. So they can do pretty much everything a medical doctor can do, short of major surgery. As the one field where we don't go into, and without specific specialized extra training and certification, we wouldn't work as oncologists, or we wouldn't specifically get into the realm of advanced medical specialties. But for the most part, if you can imagine like what an old time country doctor would sort of deal with whatever happened to walk in the door, that's sort of what naturopathic doctors do when we're allowed to practice to the full extent of our training. Now, in other states, we're licensed, but it's what's called a limited scope of practice. And in each of those states, naturopathic doctors may be able to do some of the things I just listed, but not all of them. So they may be allowed to order labs and do physical exam and order imaging, but they may not be allowed to prescribe medications. They may be allowed to give B12 shots, but not vaccines or something like that. So, and that actually varies between the different states. And then in states where we're not licensed at all, we are not going to be diagnosing, we're not going to be treating disease. We may support a person in their whole health, but we won't specifically do treatments for specific diseases. Like in Texas, where I live right now, I do not order diagnostic imaging. I don't order lab work. I may suggest lab work's needed and I have a patient go ask their medical doctor to order those, but I don't do that myself. So a wide variety of what we're allowed to do from state to state. And then because our training is so broad, naturopathic doctors do tend to specialize in various areas. So you will see some naturopathic doctors that choose to practice to the very edge of the scope of their practice, and they will do primary care, prescribe medications, do women's exams, deliver babies, do minor surgery, things like that. And then you'll find other naturopathic doctors who prefer, on the far other end of the spectrum, don't want to do any primary care and don't want to prescribe at all, and they will focus on the really old traditional healing techniques like hydrotherapy and exercise and meditation and mindfulness and nutrition and homeopathy and things like that. So naturopathic doctors, by their own choice, also, just do the whole scope of healthcare and what they particularly feel like they're gifted at, what they're interested in doing, the kinds of therapies that they're passionate about. So that sort of adds to the confusion about what a naturopath is, because there's such a wide variety, both in our personal choices in how we practice, as well as in what the states allow us to do.